So this is the story behind why I've done my app. And so underneath you'll see a picture of me and my dad, and they were good times. We had a fantastic time. He had a great life until his mid-70s, and it went downhill. And I couldn't help my dad, but I did decide I could see if I could help people in care homes, because they had very little help. And actually lots of my patients ended up being carers, you know, and far too proud to say that they're having trouble at home looking after an elderly relative. So that's one reason that I did it. I made a website, I got good videos that I thought were there, and then I thought I could do a little bit better than that. I'll put details for the rest of my patients. So I did that, and I thought, well, I can do even better. I could make an app, and that way, if you make an app, it actually focuses more on the patient rather than on the dentist. And I thought, well, that'll help, and it'll help people that don't actually get to see a dentist, and I know there's a few of them. And this was years ago. It's even worse now. So yes, what you can see there is, you know, the practice that I had. And in about 2006, you will have heard that things went a bit wrong as far as NHS dentistry was concerned. And mine was particularly bad because it nearly made me bankrupt. And then I had to do I had to go into a mixed dental practice, as you would say. And I started doing more private work, and I put people on a plan. Anyway, come COVID, I was fine, and my patients were fine. I'd done regular checkups, they had x-rays, they had good BPEs. If they had a problem, generally I knew it wasn't much. But I ended up working in my own premises for a corporate, and their values weren't the same as mine. And I thought, well, I've had enough of this. I think I can do more. And instead of dry stone walling, you know, that you do for the National Trust when you retire, I thought I'll make an app. So please, give me your feedback. I can improve it with your help. So I think we can call this a bonus track. The reason I did the app was really to promote public prevention in oral health. But now we know it's public prevention in health. And the whole thing is really was an MVP, and you can see the sort of progress I've made so far, but it's clearly not perfect. I'll just add a few little things that I think should be added on the next version, and I'll probably call it a DHS, a dental health service, because what we have at the moment is a service based all around treatment, and what works for dentistry also works for health. So please have a look at the videos. They might be a bit long. Here come the cavalry, and I hope you can help.